I've started.
You started the recording, okay. And I think we just wait for a few more people as well. Just if you could let them in, Lewis, please, as well. Okay. Hi, everyone. Thanks for, really appreciate you coming to the webinar today. We've got some really good speakers today. It's going to be about techniques to engage people in physical activity. I'll just show you the outline of what we're going to discuss today. The first talk is from Dr. Kim Gregory, consultant in sports and exercise medicine at UHB, and it will be discussing how motivational interviewing can be used to engage people in physical activity. And we're also going to discuss some of the signposting to various resources to do that. Then we're lucky to have Chad and Sally from the Be Active Plus service, part of the wellbeing services, to talk about their work and how they encourage people into physical activity. And we've also got Stephen, who is business manager at Omnium Practice in Borsley Green, done excellent projects in regards to social prescribing and putting that into action, really. We really want your feedback today. So just in a second, I'm going to post a link into the chat, and we'd really like to hear from you, answer those questions if that's possible. And at the end of each section, there'll be ability to ask some questions as well, okay? So, so just that. So what I'm going to do now is just going to come out of this. And just going to post the link for the feedback, and then we'll have our first speaker to talk, okay? And I'll put this link in at the end as well, just in case you have to leave halfway through or something like that. So I'm just going to go back into this.
Right, I didn't finish.
Lewis, can you see that?
Yes.
Yes. Okay. So over to Dr. Gregory to take it from there, really.
Except I can't see your screen, James.
Right. Sorry, we had a bit of a technical issue there. Lewis, can you see the screen?
Yes, yes, I can.
Okay.
Can you see the presentation or the drop down?
The drop down. We need to click on the presentation, if possible.
So that is under. Sorry about this, everyone. Where is that? Sorry.
Just try and minimize that screen, James.
Yeah.
See if that does it.
Okay. So just. Can you see that at all?
No.
No. Okay.
No, we're looking at your list of files.
Yeah, can you double click on it to open the file, I think.
There
you are.
Yeah, we go.
There we go.
Good. Yeah, sorry about that, everyone.
And then just put it on to slideshow. Perfect.
Brilliant. Sorry about that, everyone.
That's all right. So, well, thank you very much for asking me to speak. As James has said, I'm a consultant physician in sports and exercise medicine at University Hospitals of Birmingham, and I run the sports medicine department there. So I've been asked to talk about some motivational interviewing around how we can support people to engage in physical activity. So the outline of my talk is going to be around supporting a change in health behaviour. So to do that, we need to understand behavioural change and a person-centred approach to the care, how to enhance the motivation to change, and that's by using motivational interviewing. And then I'm going to direct you to some resources that are freely and widely available to help support the change in the populations that you're working with, both to support you supporting them, but also for them to pick up it themselves and guide them. With all of them have case discussions.
Okay.
So There's quite a few models of behavioural change that have been used to help us understand health behaviour and how to inform the design of interventions for changing health behaviour. Quite a complex topic, and the COM-B model is the one that's demonstrated here on this slide. The COM standing for capability, motivation, and opportunity, which all feed in an interrelated manner towards behaviour. So an individual, if they're going to change their behaviour, has got to feel both psychologically and physically able to do this. So that's the capability aspect. And then they've got to have the social and physical opportunity for the behaviour to actually occur. So that's the opportunity. And want or need to carry out the behaviour more than the competing, usually opposite behaviours, which is the motivation. So as each of these components interact, and they're quite complex interactions, any intervention that we put in place as practitioners or supporting friends and family in terms of directing a behaviour and health change, you've got to target at least one, if not a couple of these, to actually get the desired behaviour impact and change. But then you've also got to maintain it. So if we're going to look to change behaviour towards being more active, the support needed to alter the balance between their need to be physically active in the case that we're talking about today and their want to relax and remain inactive. Because likelihood is that their capacity and their capability and their opportunity to achieve their want is probably already high, whereas their need is where we're going to struggle more. So in terms of supporting individuals, you're trying to frame physical activity as both a need and a want for an individual to drive that behavioural change. So why won't people be able to make this change? And what is it you're trying to break through? Well, that's, have they got the suitable social support? What's the health behaviour changes in people that they're surrounded with on an individual family basis, work communities, wider communities, their access to healthcare? What's the perceived lack of opportunities from their point of view in order to facilitate this? What are their health concerns? There's many people who feel that because of a health condition, they can't become more physically active, or that is actually the barrier to them becoming more physically active. So it's being able to adapt and come up with different ways of being physically active. And also lots of people think physical activity means organised sport rather than just being more active around the home, going for a gentle walk, doing the hoovering. And the commonest barrier is lack of time. So how can we help people make these changes? It's about understanding their barriers to change. So working with the individual to find out exactly what do they perceive as their barriers, not what you think as the person that's trying to help them, and taking a person-centered approach. So what works for one doesn't always work for another. And then it's looking at tackling the barriers. And this is where it's important that all the stakeholders, those listening here, wider in the community, work together and link strategically across the various sectors in the city. And I think that's something that Birmingham's good at. So how do you enhance that motivation to change? So motivational interviewing is essentially adopting a guiding style and eliciting change talk. So it's often phrased in terms of engaging, focusing, evoking, and planning. And underlying that, you've got the stages of change. So people are either pre-contemplation, they're not really thought about it. You've got the contemplation stage where they're thinking about it, and then they move towards preparing to change their behaviour. And then they might actually start actioning those changes before they try and maintain them. So motivational interviewing, using this guiding style, you're trying to clarify their own individual strengths and aspirations. Where do they want to go with their behaviour change? Trying to work out what their motivation for change is. Is it financial? Is it health? Is it just general fitness? Is it somebody's told them it would be a good idea? And you're trying to promote autonomy in decision making. And it's often based around the fact that it's how we speak to people. It's likely to be just as important as to what we actually say. So listening to them, understanding is an important part of that process of change. People who have the problem, so in this case, those that are wanting to become more physically active is the problem in this context. They're the ones that are going to have the answer to solving it, because it's going to be what have they got accessibility to, what do they enjoy doing, to come up with that answer. And they will only change their behaviour when they feel ready, not when they're told to do so. So the solutions people find for themselves often are the most enduring and the most effective. And certainly when I'm consulting with patients around physical activity, I always say it has to be regular in terms of physical activity, and it's got to be something you enjoy. If you don't enjoy doing it, you are not going to stick to it. So if we look at the engaging side of things, it's getting the person talking about it. Can you just go back?
Yeah, sorry.
Get the person talking about physical activity, individualized to them, being quite collaborative, empathic, thinking about, what are their physical barriers and their social barriers or their psychological barriers, and acknowledging that these will exist, and not being judgmental, and being very striving towards their autonomy and their decision making. Then you get to the focusing stage, and these are around conversations around something, which in this case is physical activity, but bearing in mind that the focus might change, and you need to be able to refocus that conversation, because they may bring something else up within that conversation around physical activity that you just need to slightly change tack. Then you move into the evoking and the planning phases, which very much interact. You're trying to draw out their reasons and their ideas around why they want to increase their physical activity, what's their hopes and what's their concerns around increasing physical activity, listening for and strengthening that change talks. It's all about talking about change. You don't want to rush into a planning phase. You just feed through the momentum of the conversation. It might take several months to enact any change and move them through that stage of change. And the plan's got to be around what's next, asking them how are they going to change their behaviour. And you might find that actually they don't want to change and they're not ready. That probably means they're not in that action phase of the stages of change of behaviour. Can I have the next slide, please, James? So it's really important around the language and the questions that we use. So it's open questions. So describe to me how physical activity fits into your life right now, might be an opening question of the conversation. How do you think you would get started if you did decide to become more active, giving them the opportunity to give some suggestions, which will also enable you to decide what they feel is perhaps possible with their lifestyle. And then you've got the ask, share, ask strategy. So ask, what do you know about the benefits of physical activity for you as an individual? So you're person centering the conversation. See what their reply is, and then say, well, can I share a few more with you? Ideally returning information based on what they've said. And then if they allow you to, share that particular information and then ask again. So what do you make of what I've just shared with you? So that way you're demonstrating respect for their knowledge and their views. You may uncover some unhelpful beliefs that they may hold, and that might be a way of getting into the barriers that they see in terms of physical activity. You're sharing information in a very non-judgmental way. You're helping them make sense of some new information, and you're helping them to come to an informed decision. And you always have to be prepared that perhaps now is not the time for them to change. Can I have the next slide, please, James? So when you're in that evoking stage with that individual, it's how might you get started? What's the easiest way for you to get started? What do you think you would enjoy doing? Who can help you to be successful in increasing your physical activity? And what kind of things might help this to become a habit for you? And always acknowledge the potential barriers arranging. And goal setting is a good way to do this, with them coming up with some smart objectives. So they'd like to go jogging. They could go every day, but you wouldn't necessarily start every day. Just a simple 15 minutes, build it up. It's relevant to them because it's something that they enjoy. And you set some time bounds to it. So it might be that I'm going to start in January as a New Year's resolution, or because actually I want to complete a park run, for example. And then it's making sure that they've got the social support in place to be able to get this, both in terms of practical support to get to and from somewhere or financing it, and also the emotional support as well. Can I have the next slide, please? So there's lots already of resources out there to support you in engaging people, which you can direct them to. So moving medicine's quite medical, gives evidence base, gives you various strategies, and there's action packs that you can print off. And also it's linked to the disease specific or condition specific ideas, and it takes it through from just general activities of daily living to suggestions of more organised sport. Motivate to Move is another similar project, and you've got Dr. Mike Evans' 23.5 hours video, which is a cartoon based video which gives a lot of information about the importance of being active for that 30 minutes a day, and is quite, all three of them have similarities and contrast in the way that the information is presented. So having a look through those and determining with your particular population group within the city, you can see which one may be better to signpost them to. And then in addition, there's ones that are very much focused towards the general population and different sectors, allowing for disability, allowing for cultural differences. So you've got This Mum Moves, focusing very much on new mums and integrating activity with children. This Girl Can is a very positive campaign around getting girls more involved in physical activity. And then We Are Undefeatable, which focuses a little bit more on the disability and impairment options. So there's multiple resources available there, geared more towards healthcare professionals or coaching, and those that are more directed at the general public, but there's a lot of crossover, and I've used all of them, and I've used all of them well because they all have case studies that you can relate to, so you can relate those case studies to the individual that you're trying to support. So we've discussed the importance of understanding behaviour change, and it's fundamental to increasing people's physical activity, but it will be very individualised dependent on what stage they are around their own health beliefs. We've looked at how motivational interviewing can be used to help people engage with physical activity, the benefit of using SMART goals that are individualised, and the importance of the fact that you need to have the social support for individuals to engage them in physical activity, and also important to realise that physical activity is just that, it is not organised sport, but organised sport is part of physical activity. And we've highlighted that there's a multitude of resources out there which are all evidence-based that people can engage with to help them increase their physical activity.
Okay.
Thank you.
Thank you very much, Kim. That was a brilliant talk, very interesting. Lewis, I don't know if there's anything in the chat, any questions directed towards Dr. Gregory? Lewis?
No, James, not so far.
Okay. Okay, well, thank you very much, Dr. Gregory, for that a really interesting talk. And we will now move on to our next speakers. So I'll stop the sharing there, and I'll hand you over to Chad Boden and Sally Formon from the Wellbeing Service, and specifically Be Active Plus. Thank you very much.
Thank you, James. I'm just getting my screen up. Bear me 1 second. Is that screen coming up, James? Can you say?
Yep.
Yeah, that's coming out okay.
Trying to just get into slide.
So I think we've got Chad. I think we've got a question. I don't know if Dr. Gregory, if you're still there. There's a question here.
Yeah, I was just going to answer it in the chat.
Oh, you're answering in the chat. Okay, that's fine. Yeah, that's great. Thank you. Yeah, Chad. Sorry. Yeah, carry on. Sorry.
I'm just trying to get my into
presentation mode. Yeah, if you go up to the top of the screen there,
yeah,
you see
it's covered by a bar at the moment, like a black bar. Do you know how to get rid of that?
black bar. If you minimize the screen a minute.
Okay.
Does that make any easier to see the options there?
Yeah, that's great.
Yeah.
Okay, perfect.
Brilliant, thank you.
Excellent.
Yeah, that's brilliant.
Thank you, James. Brilliant. Yeah, good afternoon, everybody. So as James has said, myself and Sally have been invited this afternoon to talk a little bit about the Be Active Plus program. You know, what it is we do, what we offer, and then looking at some of the successful outcomes that we've had with some of our clients along the way. So without further ado, first of all, we'll take a look at what actually Be Active Plus is. So Be Active Plus is the GP referral program across Birmingham, and it's delivered at sort of various venues across the city. It's delivered as a service by Birmingham City Council Wellbeing Service, and registered healthcare professionals from across the city, GP surgeries, can refer into it, and hopefully you know, get their patients engaged with some physical activity. Now, the overall aim of the scheme, although it's a very broad range of clients that we work with, the overall aim of the scheme is to provide support, motivation, and guidance to inactive people with long-term medical conditions. As I say, it's quite a diverse bunch that we work with, but the underlying principle is always the same. The GP referral is not new to the city. It's been around for well over 20 years now in some capacity. It started out as exercise on prescription way back in the 90s. And you know, throughout the years, things have evolved. The way we work has changed. Some of the methods we use have changed. But that underlying principle of, you know, and the main aim of the scheme has pretty much stayed constant and still remains the main sort of focus today. So I'll just take a look now at who can actually be referred onto the scheme. So as I said, the main criteria is really, we are looking for people who would benefit from some form of physical activity. But there are certain criteria that have to be met for that. So first of all, the patient has to be registered at a Birmingham surgery. So for example, somebody who has a GP in Solihull, they wouldn't be able to refer on to Be Active Plus, although they do have the ability to refer onto their own schemes. But we only take referrals from Birmingham surgeries. They also need to be aged 14 or over, and they need to be sort of meeting some sort of medical kind of criteria. So on this table on the screen here, which is a low risk table from risk stratification, anybody that is ticking 3 or more of these conditions is eligible to be referred on to the scheme. So for example, somebody who's slightly overweight, possibly, you know, BMI 26, 27 maybe, and they may have type 2 diabetes, but not medicated. And they may be, you know, sort of over 65, but at no significant risk of falls. So they'd be deemed as sort of relatively low risk from a medical perspective, but they would be eligible for for a referral onto the scheme. Anybody who is only sort of meeting 1 or 2 of those conditions, unfortunately wouldn't be eligible for the scheme, but there are other options available across the city, one of which is Be Active, which is a scheme that kind of runs parallel to ourselves. And that is a scheme which is open to anybody who lives in Birmingham and gives them the opportunity to become more active for free. Also eligible are people who fall into sort of the medium risk category, if you like. Apologies for the small table there, but it was the best I could fit on. But I will run through a few of the conditions, and ultimately, if anybody would like to look at it in more detail, we can forward it on for sure. So again, from a medium risk point of view, all the patients would need here is to be fitting into one of these boxes, if you like, one of these conditions. So for example, somebody who is classed as obese, so their BMI is over 30, that they will be eligible. Somebody who is a type 2 diabetic, but they require medication to control that condition. Again, they would fall into the medium risk category, but would be eligible for a referral. Okay. And then finally, on this section, I'll just take a look at who can't be referred. So unfortunately, there are certain people that, for whatever reason, we sort of can't help on the Be Active Plus scheme. But as I said, there are other other schemes and things around which could hopefully be useful for them. So the people that unfortunately we can't accept would be anybody that has a surgery outside Birmingham, as I said earlier. So people from maybe Solihull or Sandwell, they will have their own schemes which they refer into. Patients who have less than 3 of the low risk conditions. Again, as I mentioned earlier, if I just whiz back, so anybody who doesn't have at least 3 of those conditions would not be eligible for a referral. And then finally, patients that would be deemed sort of a medically high risk, or they have conditions that would be exacerbated through exercise or by exercise potentially. Again, so I'll just put a table up there of the conditions that unfortunately would make somebody unsuitable for referral. Again, apologies for the size. It was a bit beyond my IT skills, but I'm happy to send out any copies to anybody that would like to see it possibly a bit closer up. But we are talking about people who have had a stroke, possibly within less than a year. Unstable diabetes, uncontrolled hypertension. So especially sort of with the 160 over 100 is sort of a limit that we kind of use. But there are other numerous conditions and things on there. Obviously, as situations change. So for example, somebody may have had a stroke 10 months ago, and at that point in time they wouldn't be eligible to be referred. But actually, once that 12 months has passed, provided there has been no new issues, then they are more than welcome to come and join us. I'm just going to take a look now at the referral process itself and how that kind of works and what sort of things we do in a little bit more detail. So just bear with me as I run through. At the top there, you can see where the arrows are, our main sort of sources of referrals. So predominantly it's coming from GPs. We do certainly get some from practice nurses and so on as well. And then to a lesser degree, physios and other sort of allied health professionals. So once a suitable patient, is in surgery and then maybe having that discussion with their GP, that possibly they're looking to become more active, or perhaps the GP feels that this person could benefit, medically and mentally, possibly from engaged in more physical activity. Then that discussion could take place, and if all the parties agree, then a referral can be made. All the forms for Be Active Plus are held at the surgeries, so they're already embedded on the computer systems, certainly at most, if not all of the surgeries across the city. We do, however, hold some forms ourselves as well, so if there are any issues at all in getting hold of forms, we're very happy to give them out where required to get signed off at the surgery. So once a referral is made, the form is processed and sent off to a central office where the relevant data and so on is inputted, and it's then passed on to the relevant health and fitness advisor. Now that is usually based upon locality. So for example, where I work at Fox Hollies Leisure Centre, I'll get a lot of referrals from Acox Green, Hall Green, Yardley, those sorts of areas. So it tends to be localised. However, if patients do have a preference for another site they would like to go to, then that is fine. So it's not set in stone. It's just that usually they would end up going to their nearest centre. So once that referral is made, it will come through to ourselves and we'll get a notification of the referral. We will then make contact with the client, run through why we're calling, what we're trying to do, and then arrange an appointment for them to come in and have a chat with us, which would then lead us on to the initial consultation. So on the initial consultation, the client will come along and meet their health and fitness advisor at the centre, wherever they are based. And that will be a one-to-one consultation usually. However, people are very welcome to bring along friends or families for support if needs be. That's usually as a one-to-one consultation where we will discuss their medical background, what medications to take, their goals, what their interests are, explain how the scheme works, and really just sort of build a bit of a rapport with the client, and sort of get an idea as to how best we can help them. During the initial consultation, we will also take some measurements from the client. We will take their height, their weights, which then leads to the BMI, their blood pressure, along with the resting heart rate, and we'll also get them to fill out, providing they're happy to do so, a mental well-being scale, like a mental well-being Web scale. So we'll get an idea as to their mental well-being currently. Once that's kind of complete, we'll then have a chat about, any dietary issues, whether they're smokers, their alcohol intake, things such as that. And so we're really kind of building up a big picture as to, how things are for this person at the moment, and possibly what we can do to help them achieve their goals. So once the initial consultation is done, we'll then come to an agreement with the client about what sort of path forward is best, or certainly on the face of it is best. Things can change, obviously. And then an exercise regime, if you like, is agreed, and the 12-week will begin from a set date as to when that may start. Now, the exercise that we sort of offer and stuff is not always as cut and dry as, oh, well, they end up in the gym and that's kind of what they do, which is sometimes the idea that people have, because a lot of us are based in leisure centres and so on. But actually, there's such a big range of things that we can source and access and sort of refer people to if necessary. That does include the gym, and so to get them started, it may involve a gym induction. It could be that they end up joining one of our walking groups, or they go along to a stroke group. We have COPD classes running, swimming they can access. We have learn to ride schemes on cycling and so on. There's active parks, which we can refer to, where they have yoga and Zumba in the park and so on. So there's a really, really big range of things that we can offer based on that individual's needs. And so we try to work at the best path forward based on their goals, what their interests are, and then agree that between us to move forward. So once those sections are started, the 12-week begins, and then we continue the ongoing support and reviews throughout the 12 weeks. So it's not a case of they turn up once at the beginning and then we see them at the end, once they've just gone on their merry way. We actually do engage throughout the 12 weeks, phone calls, appointments if necessary, reviews where necessary, just to make sure that actually they're still on the right track. The exercise they're doing is still relevant, they're enjoying it, and it's beneficial. And if not, we can make the necessary changes along the way. And then at the end of the 12 weeks, we meet up again on a one-to-one basis, run through how the program's gone, what success has been like, retake the measurements that we did back at the beginning for comparison purposes, and obviously then that data is sort of looked at further down the line for overall scheme sort of success. And then hopefully that person is engaged sufficiently to continue on and either move into sort of more mainstream exercise, or they've already established a good base of exercise and continue things on. If not, then we do review things at 3 and 6 months post finishing with us as well, which again is another good chance to catch up with people and to see how they're getting on. Okay. And then finally, for my part, I'm just going to look at actually why refer in the first place. It may be kind of stating the obvious that obviously exercise is beneficial to everybody really, but in terms of the actual Be Active Plus scheme itself, there are sort of many benefits, especially for people who are pretty inactive at the moment. and may not be very confident in an exercise environment. So first of all, you know, the referrer, whether it be the GP or the practice nurse, they know exactly who their client is going to see. So for example, if a referral is made to Foxholly's Leisure Centre, then that client will come to me. There's no two ways about it. So there is that accountability and that kind of trust and stuff that actually, you know, you can name the person that they're going to see. From an individual basis, you know, as I said on the initial consultation, we work very close with the client and make sure that actually what they're doing is suitable for them. It's not a one case fits all sort of a regime. It's very much individual based, looking at, you know, their interests, their medical background, medications they're taking, their fitness level possibly, and build up a picture and then sort of work with them on that. Which I say, we work very closely with them throughout the 12 weeks. Where more time is needed for that person, then we will give that time up. Some people need less, some people need more, and we appreciate that and work on that kind of basis. But certainly where extra support is needed, then extra support is given without a doubt. We also have very highly qualified and experienced staff working on the scheme. I won't steal Sally's thunder because she's going to talk about that in just a second. But rest assured, you know, the staff that we have on the scheme have been doing it for a very long time. We all hold qualifications sort of well above and beyond what you deem as a standard fitness instruction qualification. So you do have that kind of peace of mind as well. Obviously, from a client point of view, as a result of the referral, they can access free activity sessions, which is kind of part of the deal, really. So they will be able to access gyms and swimming pools for free, Monday to Friday between 10 o'clock and 3 o'clock. And then after 1 p.m. on a weekend, for the duration of the 12 weeks, they can access that, and it's absolutely free of charge. And then as a final well done at the very end of the 12 weeks, they are offered, they don't have to take it obviously, but it's an offer that's there. They are offered a heavily discounted membership. So if they wish to join up and use the facilities ongoing in terms of classes or gyms or swimming pools or whatever, then they could pay, it's currently £15 a month. It's obviously been quite a while since I've been engaged with that. But for £15 a month, they can access the swimming pool, the gyms, the classes, at any of the sites that are sort of within the scheme, and all within that same price, as opposed to a regular member who's probably paying sort of in excess of £35 a month for that same membership. Okay, and on that note, I shall pass you over to Sally to continue on. Thank you.
Thank you, Chad. Good afternoon, everybody. My name's Sally, and I'm going to continue where Chad's just left off. Just letting you know, where is Be Active Plus available? So Be Active Plus is a city-wide service open to Birmingham residents and patients who are registered with a Birmingham GP surgery. The patients that are referred by their GP are invited to attend a Be Active Plus programme at one of the local centres. This will either be a wellbeing centre, which is managed by Birmingham City Council, or one of the leisure centres, which are managed by Birmingham Community Leisure Trust. We have 6 wellbeing centres across the city, and these are Handsworth, King's Standing, Nechells, Saltley, Shard End and Small Heath. Then we have 4 leisure centres, and these are Coxmoors Leisure Centre in King's Heath, Erdington, Foxholly's in Acox Green and Stetchford. There are also a number of other centres that can be used, but these centres do not have a health and fitness advisor based at these sites. Due to the popularity of the scheme, this can mean that the client may not always be seen at their most local centre, and they may have to travel to a site that has a health and fitness advisor to enable their initial consultation. This can be a barrier for some due to the cost of travelling and sometimes the distance they may have to travel away from their home. We do explain that this is necessary for us to get the programme started, but there are options for them to use other more local centres near to where they live. The scheme is very flexible, and the clients can use other Birmingham City Council and other Birmingham Community Leisure Trust centres once they feel that they're confident to do so. At present, we are in discussions with National Express, who will hopefully provide us some support with bus travel to those who are struggling. Next slide, please, Chad. Across the city, like Chad said, we've got 9 health and fitness advisors, All the health and fitness advisors are first aid trained. We've got advanced level 3 fitness instructor status, and we all hold a level 3 GP referral qualification. We've all taken part in doing some level 4 specialist instructor qualifications. As a group, we all hold varying specialist subjects such as cardiac rehab, pulmonary rehab, stroke rehab, cancer rehab. Some of us have done mental health level 4, diabetes and obesity. Some of us have done back pain, postural stability and falls prevention, and extend training, chair-based exercise. With these qualifications, many of us teach specialist groups that are really well attended. Thank you. Next slide, please, Chad. The successes of Be Active Plus is knowing that every day you're making a difference to someone's health and well-being. You know, taking part in regular physical activity and having the support and guidance and motivation from an experienced health and fitness advisor can help build confidence and self-esteem. It can help reduce their anxiety and depression, reduce the risks of major illnesses such as heart disease, stroke, type 2 diabetes and cancer. Can also aid with their weight management and improve joint pain and stiffness. This can also improve their sleep quality. Exercise can be fun and have a huge social impact, have a huge social element. Throughout the years, we've had many wonderful success stories. Here are just a few I'd like to share with you. Next slide, please, Chad. This is a success story from Nechells from the Wellbeing Centre in Nechells. A patient was referred there to Alan, suffering with anxiety, depression and obesity. On their first appointment, they weighed in at 18 stone and had a waist circumference of 45 inches. They engaged in regular activity, attending the gym 3 times a week. And on completion of their 12 weeks, they reached 16 stone and had a 40-inch waist. With continued support and motivation from Alan, alongside a healthier diet, at the beginning of lockdown, this gentleman was 12.5 stone and had lost another 6 inches around his waist. As lockdown went on, he got himself a treadmill, which he uses regularly, and he can't wait to get back to the gym once all the restrictions are lifted. Next slide, please, Chad. These I'd like to share with you. These are just some messages from our clients that we receive in forms of letters, thank you letters and thank you cards. I'm just going to read a couple of quotes out here to you. Just want to say a big thank you for the help you've given me. The programme has helped me hugely. I'm more relaxed and have lots more energy. I look forward to working with you more and getting even fitter. The next one says, thank you, Chad. I want to say what a huge step it was for me mentally, for me to be in a room with somebody new. I would also like to thank you for your professionalism and courteous manner. I'm excited about the road ahead, losing weight and gaining more confidence. And the next one is, next slide please, Chad. And the next one is the power of an exercise class, just to prove that exercise, you know, that the social side of it can be just as important as the exercise. My group meet every Monday for their Happy Hearts circuit training class. It's a mixed group, mainly 50 plus. All participants have been referred through Be Active Plus. I've had a gentleman referred, 69 years old, with anxiety and depression. He lived alone and had no family. I invited him to join the class. It took me a while to get him to engage with the group, but after 6 weeks, he started to join them after the class for a cup of coffee and a chat. Friendships were made, his confidence grew. He is now a completely different man to the one I met at first appointment. During lockdown, he was really struggling with his mental health. The group set up a WhatsApp page to help him keep in contact with everybody. They have regular quiz afternoons, share recipes and photos of what they've been growing in the garden. He has said to me on many, many occasions that his exercise class and the support and kindness that the group have shown him have been his lifeline through the pandemic. These are the kind of positive outcomes that makes us all love the job we do, and to know that every day we help to make a difference to someone's health and mental well-being. Next slide, please, Chad. So what have we been doing during lockdown? We have all been working from home and keeping in regular contact with the clients and having a friendly chat and a listening ear. We've been making regular daily, weekly calls to clients to see if any help is needed with shopping, medication, hospital appointment trips, and if so, putting them in contact with the relevant organisations such as the NHS volunteer responder programmes to get them the help that they need. General wellbeing checks, just chatting about their health, diet, exercise and hobbies, and encouraging and motivating them to do more exercise, maybe even just to go out for a little walk or do some small home exercises. We've been providing help and support with food parcels through the Active Wellbeing Society, which is an emergency food parcel for those who are struggling to cope and requesting the help if they need it. We've also been using our time to take on new training courses such as the Make Every Contact Count, smoking cessation, COVID-19 recovery and rehabilitation, suicide prevention, keeping us all up to date and learning new skills. Over the last few weeks, we have been working on the rebranding of Be Active Plus, looking at new name changes, introducing fitness testing and looking at different ways to assess, monitor and measure our outcomes. Looking at more ways that we maybe can social prescribe and signpost clients onto other things to help further improve their health and well-being. And if all goes to plan with the lifting of the lockdown, we're all hoping to be back in the leisure centres from the 12th of April, welcoming our clients back and introducing new ones into the scheme. Thank you for listening today, everybody. If anybody's got any questions, please let us know and we'll try to answer these for you. Thank you, James.
Great. So thank you very much, Chad and Sally. That was a really interesting talk, and it's quite clear that the Be Active Plus has some fantastic results and is having a real impact. So that's absolutely fantastic. There is a few questions, some of which have been answered as you've gone along, some of which might be very difficult to answer. I don't know if you know, is there an equivalent in Solihull at all, and what the name of that is?
Yes, there is an equivalent in Solihull. It's called DocSpot. So it would be contacting them in Solihull and finding out how to access their scheme, but it is called DocSpot. Thank you
very much, Sally. I really appreciate that. I'll just quickly go down here. Is there a scheme like this in Ireland? I don't know the answer to that. Does anyone know the answer to that question?
I don't,
unfortunately.
No. I think that might, sorry about that. For the person who asked that question. What is the best exercise referral qualification for certified personal trainers? I know you did talk about qualifications there, but I don't know if you could. So it's the best exercise referral qualification for certified personal trainers.
Yeah, so they'll be after a GP referral qualification initially, because that then opens the door to sort of be able to work with people with varying medical conditions, and there's various organisations that offer that qualification. And then following that, if you then wanted to sort of specialise as some of us do, you can then work on your level 4 with your cardiac rehabs or your pulmonary rehabs. But yes, certainly in terms of starting off from a personal training point of view, it would be your GP level 3 referral qualification that you'd need to really sort of open the door to everything else.
Thank you very much. Thank you very much, Chad. Another question: what proportion of activity is done outside, including nature, as part of the benefit? So, what proportion is being done outside in the wellbeing centres at the moment? I suppose we could answer it through that question, really, through that line.
I mean, it is down to personal choice of the clients and when they come in to see us and their choice, really. What we try and do is we try and offer a wide range of activities, and hopefully then the client will kind of make that decision for themselves, whether they'd want to go out and do a walk in the park, or whether they'd like to, learn to ride a bike. So yeah, there is, I would say it's probably 50%. because we've got the option of the swim and the gym and some specialist exercise classes in the centres, but then there is a big offering of things like Tai Chi, outdoor yoga, walks in the park and cycling outside as well.
Right. No, thank you, Sally. That's really interesting. There's a question here from Jenny Wickett. I think that was probably when Chad was speaking, but Sally, it's probably relevant to yourself as well. What measurement model scales are you using in regards to the wellbeing scale as well? So what kind of models and scales are you using with the Active Plus clients, particularly wellbeing scales?
Well, as I say, we take the general kind of measurements, you know, the weight, the blood pressures, things such as that, as a measurable comparison, if you like, along the 12 weeks. We also then do the mental wellbeing scales, so they will answer questions on the initial appointment if they want to. It's not compulsory, but they will you then get a sort of a score from that mental wellbeing scale. And the idea is that hopefully that score obviously improves over the 12 weeks and potentially they're less stressed, you know, less anxious maybe, things such as this. So a lot of it is sort of measurable in the sense of, you know, blood pressures, weights and so on, but we also do the mental well-being side of it in terms of using the OneWeb scales and having the results there to sort of monitor along the way.
Thank you very much, Chad. This is I think Katrina asked a question, Katrina D, how much taking place during the pandemic? I think that question was answered there in the talk. What is the ideal interventions GPs can do to promote strength and balance at home to reduce the risk of falls? Deconditioning is likely to be widespread. I agree with that. I'd love to know what we can do for patients who do not have mobile phones and internet to send out to patients with mild to moderate frailty. I don't know, maybe just to talk a little bit about the patients that you see with kind of frailty, falls, that kind of thing, what support you can offer.
I mean, within the leisure centre, what we offer is we've got things, specialist groups. We run an osteoporosis group and a general mobility and exercise group within the centre. And these are for people who have got that, you know, that problem with falls and balance. But at home, I would say just to, it would be the idea to encourage them to maybe use a chair to do some exercises, you know, just to sit to stand, or maybe to use the back of a chair for balance. It is quite difficult when you are working with somebody. We do have this quite a lot with some of the groups that don't have mobiles and don't have that access to the computers. That's why the groups, if we can get them into the centre and we can get them using the exercise classes that we've got on offer, which are specialist groups.
Okay, thank you very much. And then there was a question about the cost of it. Is the initial part of the program free, 12 weeks, then membership discounted thereafter? Just to clarify on the costs.
Yeah, so in terms of the costs, anything that we offer from a health and fitness, any appointments that we make and so on are all free. So there's no actual charge as such to see the health and fitness advisors in any capacity. The free access entitles the client to access the gym and the swimming pool between 10 o'clock and 3 o'clock Monday to Friday, and then after 1 o'clock on a weekend. And that is for the duration of the 12 weeks. So if they turn up at those times to use the pool or the gym, then there is no charge whatsoever for that 12 weeks. If, for example, a client wanted to, it doesn't happen very often, but if a client wanted to go and do a step class, for example, then charges would occur for that unless they had a separate membership with the leisure centre or something. But as I said before, you know, there's a lot of free offers across the city as well. So you've got your active parks, where there's the yoga and the Tai Chi and so on. There's the Birmingham bike scheme where you can hire bikes for free and be taught to ride a bike completely for free. We have walking groups which are running, which are completely free. So the vast majority of the things that we kind of refer on to, or we do ourselves with the gym and so on, are free. There's very sort of narrow scope of things which aren't. It's usually sort of the extras, such as the classes and stuff, that aren't part of the scheme that would be chargeable, but everything else is free for the 12 weeks. And then at the end of 12 weeks, they are entitled to the reduced rate membership, should they wish to take that, or if they wanted to carry on coming to walking groups or carry on going to the active park stuff, then that will continue to be free as long as that service is on offer.
Great, thank you very much for that. We appreciate that. There was a question, are you doing virtual fitness sessions as well? I think that's the final question before we go on to our final speaker. So thank you very much.
No, we're not. We haven't been doing virtual fitness sessions. We've been working from home, doing just mainly keeping in contact with patients and making sure that their well-being, checking on their well-being, and helping in other areas where we can kind of look at getting their medication delivered if they need that sorted out and things like that. Great.
Thank you very much, Sally and Chad, for the presentation and answering all of those questions. I really appreciate your time and support today.
No problem.
If there is any more questions, then if Chad and Sally are around, if you'd put them in the chat box, please. Lewis, can we see the presentation? Is that okay? Or?
Yeah, it's up.
Yeah, that's good.
Yeah, so sorry, Stephen, for the delay in coming to presentation.
How long have we got, James? Just
we've got as specified in terms of the time that you need to have there. So whatever time you need there. So I'm going to pass you across to Stephen O'Halloran, Business Manager at Omnium Practice, to talk about the excellent work they've been doing.
Hi everybody, thanks for having me. Thanks to Dr. Gregory, Chad and Sally, because what I'm probably about to talk about incorporates a lot of what they've done, or the whole series of it, and takes it into quite a practical element. So I'm a business manager of a GP practice in inner city Birmingham, basically opposite Heartlands Hospital, so ethnically diverse, fairly socially deprived. So this project came out of a mental health MDT that one of the partners of the practice was interested in, and we came across a group called the Active Wellbeing Society Tours. So between the lot of us, we basically came up with an idea of having a social prescribing hub within general practice. If you move on to the next slide. So Active Wellbeing Society, as you can see, was set up quite a few years back, and the idea was to effectively work with them to create a slightly different model of how we could do something entirely practical. So if we move on to the next slide, I'll skip through the early ones. So what they did is they work across different sectors, delivering health and well-being using people like Sahili and other players, plus of course the council, the different councils, and Sport England. So if we move across to the next slide, please. So their footprint is quite wide across the city. It's grown probably since this point, and their target population is, to be honest, more or less anyone that has a need of any kind of intervention, a holistic intervention that helps them with a sort of sports slant, getting well, mental health, well-being, all of that, all rolled into one big thing. If we move to the next slide, please. So this actually started from a Sport England Active Communities LDT pilot, who was done within partnership with Sahili, who we'd already worked with in the practice. And again, the idea was to bring people together and get them to move on through a process of working together through sport and then from mental health wellbeing. If we move on to the next slide, then I'll slow down on the slides at this point. So the idea was, there was a number of ideas, but was to bring people into activity by stealth. It's deliberately put that way, because we're a socially deprived area, and it isn't necessarily the case that people are going to basically go to gyms or any other places like that. So what we planned, or we were planning, was how we could bring that nearer to the patient to make it less threatening, less scary for everybody. So we effectively decided we were going to turn Omnia Practice. Now, for those who don't know, we're a pretty big practice, physically a big practice, a big building, a nice shiny building. So we had some space, and we decided to turn the practice into a community hub, or part of the practice into the community hub. And part of that was so that the community could regard it as a community asset, and also a safe space, because given some of the communities that we have, that basically it's not necessarily deemed okay to rock off to another place, whereas the GP surgery might be considered somewhere that they can go. So it basically meant that we were utilising the building as the first port of call, not the only port of call, but the first port of call for engagement with the tours team, and then obviously led into other things like badminton, bike rides, walking therapies, gardening, etc., etc. If you move on to the next slide. And so the idea was that if you look at the bottom of it, you can just about see the community hub. So the community hub is a physical thing. It actually exists as a space within Omnia Practice. So you have my reception desk, and then you have basically on sort of 90 degrees to it, just slightly on the other side of the reception team, an area that was staffed for about 3 days of the week by the tours team. And so referrals were done in a number of ways, and it could be the traditional referral form, etc., from a GP or any kind of health professional. But a lot of the time it was done by our own reception team. So for want of a better way of putting it, the reception team, who sometimes know the patients just as well as some of the GPs and know about their lives. You know, our reception team are local, our patients are local, so they tend to know each other. So a lot of the times the referrals were done by the reception team, effectively saying, do you want to go and have a chat with the tours team? So effectively, we turned the practice into a safe space and actually did the activities here. So if you look at that screen, we've obviously got quite a big outside space. We've got 2 quite big conference rooms and a big garden, which currently has a COVID tent on it, but never mind. A big garden, which meant that we could actually do some of the activities within the building. Now, as has been said on the Be Active Plus, now what we can do can lead into other services, but in the initial stages, we were trying to build relationships and friendships, teamwork, you know, as the crochet class that you can see at the bottom of the screen. That was a crochet class done in our own conference room here. And some of those ladies moved on to do physical activities quite quickly because they built the friendships amongst the people. And so that massively helped them build confidence to go and do something else. So we've got patients that went through crochet, went through walking, went through sort of running and bike riding. And the big car park at the front that you have, we were doing bike riding across over the weekends when the car park was closed, because the practice was open at the weekends, but the car park was closed. So there was a massive space for those who hadn't learned to ride bikes before that could be taught to ride bikes in our car park over the weekend. And that's now led into, as you probably know, for the cycling through prescribing. So people being able to have bikes prescribed to them. So if you move on to the next screen. So how has it evolved? This was a massive undertaking for both tours, Sahili and Omnia Practice, because what we had to do was work out how we could make this work, because it's a bit of a different way of looking at it. We have social prescribers, we have referral forms, as you can see on that screen, but a lot of the work was done within the practice to build with the patient's confidence. But that also meant that as a practice, we had to fully engage with that. And so our entire team had to work together, not just the GPs, not just me, the manager, but the entire team needed to understand what we was doing and why, and be prepared for, on occasions, it was slightly inconvenient at the start. We had crochet lessons and things going on in the middle of our reception team. So we all had to work together with this. But it meant that we started pushing quite a lot of patients through to these different aspects of the tours projects. And of course, word got around. And like, for example, the bike riding, we started on a really cold, horrible winter's day when it was pouring down with rain, and a few people turned up. And then over the next few weeks, we didn't have enough space. It was incredible, the amount of people that were turning up. And a lot of it, I think, was because we started the project here to build confidence in a safe space for our patients. So that really seemed to push it along quite quickly. So if we move on to the next slide. So as I said just now, for us, one of the main things was when I say working collaboratively, I mean, you've got our team here, clinical and non-clinical, and the tours, the active wellbeing team and any of the other stakeholders in the service. On occasions, all had to sit down and decide how we would make things happen in the building and the referrals out, so that everyone was on board, and for want of a better way of putting it, we all understood what each other's was doing, because I might have to schedule something in the conference room at a point the practice needed it, and we go, oh no, we'll do that somewhere else, and think about things slightly differently. We did find out that the practice was regarded by our patients as a massive safe space. So we had a lot of patients that felt they were able to come here to do certain things that all eventually had a sport-related slant to them. But as we said at the beginning, there might have been a bit of a stealth to this. They came in, will do crocheting, and then 2 months later, they're taking part in share-based exercises. A month after that, they might get on a bike in our car park. That really worked, because they were then working with their friends who they'd met in the crochet class, and that was something that we really learned from. So we managed to timetable the activities on that sort of way to try and do that. So I think the take-home message was that you need to engage quite openly, to have quite frank conversations between the teams, and to get everyone in the building involved. And then that way, everybody feels part of it. Our reception team felt part of it. They got involved. Our doctors could see what was going on. And if I'm being completely honest, it made a real buzz in the whole practice. So it's something that I would highly recommend you trying. I'm not saying it's necessarily easy to start with, but if you really engage in it and just think slightly outside the box, you can really make a difference with this. And I genuinely mean that. And that's probably, if anyone's got any questions on that, I'm more than happy to field them.
Great. I'll stop sharing the screen there. Thank you very much, Stephen. It's a really interesting talk about, and some excellent work that you've done at Omnia there. It's really sounds like an absolutely brilliant project. I'm just, if you've got any questions for Stephen, if you put them into the chat box, Stephen should be able to answer. I'm just going to quickly finish off with just a bit of a sort of preview really of our next talk, just to finish off really. Okay, and through that. Hopefully everyone can see that. Lewis, can we see that?
Yes, we can.
Yeah, just to finish off, thank you very much for everyone attending the webinar today. I'm sorry it's overrun slightly, but we've just had just such an amount of excellent content really there. So it's fantastic. Thank you for all the speakers and for all the questions and engagements. I really appreciate that. We've got excellent talk next week. We've got another 9 more webinars to go. They're every Wednesday, 12:30 to 1:30. We've got Dr. Melise DeVivo. She's co-founder of the Active Pregnancy Foundation. Has also been involved with This Mum Moves, which is sorry, I think my screen's been paused actually, my screensaver. So I don't know if you can see all of that.
You're on your list.
It's on my list now. Stop that one there. I'll go back in. Just be good to so everyone can actually. Can people see that?
Yeah.
Yeah, sorry about that. It's a bit of technical issue there. Yeah, so been involved with the Active Pregnancy Foundation and This Mum Moves, which was mentioned by Dr. Gregory, and we'll be discussing the benefits of physical activity during pregnancy and the postnatal period, some of the barriers and some of the issues there, and some resources to engage people with physical activity, which can be applicable to Birmingham. We've got James Grinstead from Sport Birmingham and a range of different colleagues talking about the benefits of physical activity in young children and a range of opportunities and programs that are going on in Birmingham at the moment in that field, really. Really welcome your feedback today, and thank you very much for joining, and hopefully we'll see you at some of the other webinars. Thank you.